Emergencies don't wait. Will you be ready? Dive into this high-stakes first aid comp where we unravel life-saving moves for home disasters, choking crises in infants and adults, assessing unconscious victims, and tackling injuries from skin burns to breathing emergencies, all in 10 minutes that could change everything. Did you know most home injuries can be treated with just 10 items? Let's break down what you need. Bandages and gauze are used in over 90% of home first aid cases. Make sure you have different sizes. Antiseptic wipes can reduce infection risk by 75% when applied correctly. Keep a few in every room. A simple item like a rubber band can help stop severe bleeding if professional help is delayed. Use it carefully. Tweezers and scissors are essential for removing splinters or cutting bandages. Choose medical-grade tools. A thermometer and pain relievers like ibuprofen help manage symptoms while waiting for help. Always check expiration dates. A cold pack and elastic bandage are perfect for sprains and swelling. Keep them easily accessible. A flashlight and emergency contact list can be lifesavers during power outages, or if you need to call for help. And finally, a CPR face mask is a must-have if someone collapses. It's easy to use and could save a life. Did you know a well-stocked first aid kit can reduce emergency room visits by up to 40%? Be prepared. Tag someone who needs to know this. What's the most important item in your first aid kit? Comment below. Every year, over 2 million injuries could have been prevented with a simple first aid kit, and you can make one in 10 minutes. Most people panic and run to the pharmacy, but you already have everything you need at home. Step 1. Grab a waterproof container, like a pasta sauce jar, and start with 10 essentials. Include adhesive bandages, antiseptic wipes, gauze pads, and medical tape. These handle 85% of minor injuries. Add a thermometer, a pair of gloves, and a small flashlight. You'll be ready for anything. And here's the kicker. You can save $10 by using a container you already own. Store it under your sink or in your backpack, and you'll wonder how you ever lived without it. Tag someone who needs to know this trick, and comment what first aid tip you want next. Every year, 50,000 people in the US choke to death, and most of it happens at home, during dinner. When someone starts choking, most people panic and try to slap them on the back, but that can push the blockage deeper into the airway. Instead, stand behind them and wrap your arms around their waist. Make a fist with one hand, place it just above their belly button, and press upward firmly. 5 quick thrusts can save their life. If they turn blue or lose consciousness, call 911 immediately. Every second counts. Over 90% of choking incidents involve food, especially meat and candy, which is why this skill is critical in every home. And here's the kicker, you can perform the Heimlich even from behind, without turning them around. Now you know what to do. Did you know waiting to treat a sprained ankle can double your recovery time? Most people just try to walk it off, but that can cause permanent damage. Step 1. Apply ice within the first 20 minutes to reduce swelling by up to 30%. Next, elevate the foot above heart level for 30 minutes to prevent long-term damage. Rest for at least 48 hours, it can cut recovery time in half. And here's the secret. Wrapping the ankle with a bandage that's not too tight can speed healing by 20%. It's all about support, not pressure, and it could save your mobility. Every year, over 3,000 infants are hospitalized because of choking, and most of these could be prevented with one simple move. But here's the problem, the Heimlich maneuver is not safe for babies under 1 year old. In fact, it can cause serious injury. The correct first step is to give 5 firm back slaps. Hold the baby face down over your arm, with their head lower than their bottom. Then, Flip the baby face up and give 5 quick chest thrusts, right below the nipple line, to dislodge the object. If the baby is still not breathing, call 911 immediately. Every second counts in a choking emergency. And here's the shocking part, more than half of parents don't know the correct technique. It's that simple, yet that many don't know it. Do you know what to do in a choking emergency? Tag someone who needs to learn this life-saving move now. Every year, over 20,000 people suffer severe allergic reactions to bee stings. And most of them could have been prevented with this one simple trick. Most people instinctively rub the sting, but that can inject up to 35 milligrams of venom into the skin. The worst part? Leaving the stinger in for more than 30 seconds increases venom absorption by 50%. The correct method is to scrape it out, not twist or pull, using a flat object like a credit card or a fingernail. Twisting the stinger can release an extra 10 milligrams of venom, and that could be deadly. If swelling spreads past the wrist or the person has trouble breathing, call 911 immediately. Every second counts. And here's the kicker. The American Red Cross says scraping the stinger removes it faster and safer than pinching it out. Tag someone who needs to know this, and comment what first aid tip you want next. Did you know that pressing too hard during CPR can actually break ribs? In fact, over 20% of people who receive CPR suffer broken ribs or internal injuries due to excessive force. The American Heart Association recommends pressing just 2 inches deep into the chest, no more, no less. To get the right depth, imagine pressing down to the height of a standard deck of cards, about 2 inches. Each compression should be at a rate of 100 to 120 per minute, like the beat of a song. Only 30% of people who witness a cardiac arrest attempt CPR, and many do it incorrectly. And here's the kicker, you can use the heel of your hand to apply the right pressure without risking injury. Do you know CPR? Tag someone who needs to see this. Comment what first aid tip you want next. Every year, over 12,000 people die from preventable causes because bystanders didn't know this one simple first aid move. Most people just let the person lie flat, but that can block the airway and cause choking. Step 1. Gently roll the person onto their side to keep the airway open. Step 2. Bend the bottom leg to help them stay in position. This is the recovery position. If the person is breathing normally, this position is safe. But if they stop breathing or are unresponsive, call 911 immediately. Only 30% of people know how to do it correctly, and in an emergency, that knowledge could save a life. Do you know CPR? Tag someone who needs to see this, and comment what first aid tip you want next. Every year, over 1 million people suffer broken bones in accidents where professional help isn't immediately available. But you can help with just a popsicle stick. Most people try to move or straighten the injury, but that can cause more damage. The right approach is to immobilize the limb right away. Step 1. Find a splint at least 6 inches longer than the injured limb. A ruler, magazine, or even a popsicle stick works in a pinch. Step 2. Place 2 sticks side by side. This adds 10 times more stability than one, just like a real splint. Wrap the splint with a towel or cloth and secure it with tape or rubber bands. Make sure it's snug, but not cutting off circulation. Call 911 immediately if the person is unconscious, bleeding heavily, or the limb looks deformed. Time is critical, every second counts. Believe it or not, first responders often use similar materials in the field when professional splints aren't available. You might just save a life. Do you know CPR? Tag someone who needs to see this. What's the first aid tip you wish you knew? Comment below. Every year, over 1,200 children end up in the hospital because of choking, and most parents don't know the right way to help. When a child is choking, many people panic and start shaking them, but that can push the object deeper into their airway. Here's what to do. Stand behind the child and slightly below their waist. Give 5 firm upward thrusts between the child's shoulder blades, fast and hard, like you're trying to lift them off the ground. If the child is still struggling, call 911 immediately, and keep trying until they cough it out or become unconscious. Only 30% of parents perform the Heimlich correctly in a real emergency, and every second counts. Could you save a child's life in 10 seconds? Share this with someone who needs to know. Did you know a broken bone can heal wrong in just 3 days if not stabilized properly? Most people try to move the injured limb or use soft materials, but that can lead to 20% more damage. Step 1. Make a rigid splint using rolled magazines, a backpack, or even blankets. Keep it firm to prevent movement. Step 2. Secure the splint with a belt or bandage. Apply it tightly but not too constrictive. Apply the splint before moving the person. Shifting the bone can cause more pain and longer recovery. According to the Red Cross, improvised splints can be just as effective as commercial ones, especially in emergencies. And here's the kicker, you can use a backpack or rolled up blankets as a splint in the wilderness, it works just as well. Do you know someone who might need this tip? Tag them now, and comment what first aid trick you want next. Every year, over 10,000 people die from choking, and many of those deaths could have been prevented with just one simple first aid tip. Most people instinctively try to help by doing a finger sweep, but that can push the object deeper and block the airway completely. Only attempt a finger sweep if you clearly see a visible object in the victim's mouth, like a piece of food or a small toy. Encourage the person to cough first. In fact, most choking victims can still clear the airway themselves if given the chance. If they can't cough, speak, or breathe, give 5 back blows between the shoulder blades, then check again. If the object is still stuck, call 911 immediately. Brain damage can occur in just 4 minutes without oxygen. And here's the kicker, forcing a finger in may actually silence their ability to cough it out themselves. Never assume you know what's best in the moment. Do you know CPR? Tag someone who needs to see this. Comment what first aid tip you want next.